pharmacy has been transforming as a profession since the beginning of time. Pharmacy and medicine at one point were actually the same profession, believe it or not. And they separated obviously over time, and pharmacy first started as its own profession by compounding medications, mostly from natural products. The next evolution was as the pharmaceutical industry developed, we turned into dispensers of drugs, and that's where the profession started to become commoditized. And I think that was maybe one of the missteps that we took as a profession. Then about 25 years ago, the education of pharmacists changed to a clinical degree. The PharmD is a 4-year post-baccalaureate clinical degree. And so pharmacists are being trained and having greater training than physicians in pharmacotherapeutic management of patients. And in hospitals, we saw that transformation apply to practice. So hospitals did a really good job over the past 25 years separating the dispensing function of pharmacy to the clinical function of pharmacy. And community pharmacy didn't do as great of a job of that. And that's accelerated, that change started before the pandemic, and the pandemic, to your point earlier, really accelerated that model. So the challenge that we're facing now is that the demand for clinical pharmacy services in the community setting is rising and outpacing the supply of pharmacists and pharmacy technicians that we have. But people still need to get their prescriptions filled.